one of the things that was taught to me when I was working with Dr. Cowden and some of them was how each tooth, you can even sometimes tell a person if they have an issue, or the equiscope, like what I did for help healing my my abscess. They even talked about how you can treat the teeth to treat the body. And I thought, okay, this is crazy, right? But how, I mean...
Okay, as a biological dentist, we use a technique called trigger point injections.
Okay.
Janet Travell and David Simon, who are both MDs. In fact, Janet Travell was John F. Kennedy's pain management doctor.
Okay.
And she did trigger points. And trigger point injections are to release the muscles that are in spasm.
Okay.
So let's say you have a shoulder. Your right shoulder doesn't feel good.
Okay.
All right. I take an x-ray. I look at the structure of the teeth. And generally speaking, I will see a root canal or an abscessed tooth or a problem in the upper right back molars or the lower right premolars. And I will take a syringe and I'll use a anesthetic with no epinephrine. Epinephrine's a vasoconstrictor. And we can talk about that because that's not healthy for you either. And I will go in and put 2 or 3 drops using a particular method of dragging the needle in the buccal mucal fold. So when it comes up and goes down to your gum, I slide that needle and I sit back and I look for a bleeding point. And when I see that bleeding point, I put the needle in 1 to 2 millimeters and use 1 or 2 drops. And then I go 2 millimeters forward, 2 millimeters forward, and I go back to the original and go 2 millimeters back and 2 millimeters back. I've had patients come in, they can't move their arm any further than this. And then I do that and they got their arm all the way up here. And they said, "What did you do?" I said, "I opened your meridian. That root canal that you have there is poison. It's toxic.